We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country and cases fluctuating here in Florida, many residents are questioning what we should do next. Face masks are required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we are going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our local medical professionals. Joining me is Alvina Chu, epidemiologist with the Florida Department of Health in Orange County. Alvina, thanks for joining us. How are you?
Great, thanks for having me.
So where are we in Orange County with the coronavirus numbers right now?
So number-wise, we're actually in a pretty good spot. We're cautiously optimistic that we've seen a general decline since our last major peak in the mid part of July. And so we're keeping an eye on things, but hoping that we don't have a major increase after the upcoming holiday, which we have seen in the past. So I think as we've seen with the phased reopening and with the holidays where people like to gather together and celebrate in larger groups than what's really recommended, we have seen increase of cases. And so we're really trying to get the message out there that folks, if you could please to help us keep these numbers down and keep us in a good place to refrain from gathering in large groups, watch your social distancing, wear your mask, and of course, practice good hand hygiene.
Excellent advice. And also, school has started, and I know that one of the things that we are watching is the chances of multi-generational transmission and wanting to be careful about that. What do you say?
Exactly. So as we've seen through this pandemic, and especially through this latter part of the pandemic, after some of the relaxation or a little bit later in the restriction measures, I think we've gotten a little bit maybe less careful as time has gone on, and maybe a little bit tired of all that's happening. But we really want people to be aware that if you are out and about, gathering in large groups or socializing with a lot of people who you don't know and have not cohorted with or maintains, your social bubble, as the phrase has been used, that you could potentially bring home coronavirus or the COVID-19 virus to your family members who maybe need to be especially more careful because they're of an older age, say your parents or your grandparents or any other medically fragile or vulnerable persons who are living in your household. And that includes children. So we know that children, while they may not they haven't during this pandemic shown more severe illness than, say, the general population. They have been shown to have a general mild symptoms or even asymptomatic. Those children could potentially also bring home the coronavirus to their family members at home. So we do want everyone to be reminded to be careful about maintaining their social distancing, wearing their face coverings to help prevent the spread of COVID-19, and also to carefully wash their hands and maintain a clean environment.
Good advice. And I know that there is ongoing testing here in Orange County, but what is the difference between the rapid testing and the PCR testing?
Sure. So actually our gold standard right now is a PCR or a molecular test, which looks for the genetic or the viral RNA of the virus. And so what is available right now is sort of a full-on PCR or polymerase chain reaction test, but there's also rapid molecular testing, which also looks for these genetic materials or nucleic acids. What's also on the market is a rapid antigen test. So an antigen is produced after the viral DNA, the virus genetic material has coded for proteins. And so that's called the antigen, and it's part of the virus that stimulates our immune system. So there is another kind of a rapid test called a rapid antigen. And so those have become readily available through places like your doctor's office. It's sometimes used in hospitals for screening. And it's also available, say, at point of care, like Walgreens or at a CVS. And also rapid antigen has been used in some of the community sites that have been doing mass testing available to our community. So it's presumed, a rapid antigen test is presumed to be really good in times when you're symptomatic, so actually producing antigens or viral proteins. And also at times when the virus circulating in the community is high. So there's very few reasons why a rapid antigen would be positive, but there's actually a whole lot of other reasons why a rapid antigen might be negative. And so these are things we want to be careful about, when interpreting tests, is what is the context of where you're getting the test taken? What is the context of whether or not you are ill or not ill? Have you been exposed or not exposed? How long from your exposure are you being tested? Because that sort of it matters, because you might have different viral shedding that we can detect through these different kinds of tests. The sensitivities are different. There's another kind of test that I wanted to bring up, which is the antibody test. So an antibody test doesn't actually diagnose whether or not you have an acute infection or an acute illness. What it looks for is whether or not you've developed any kind of immunity or antibodies to a previous infection. So, and there are some tests available now. The accuracy is up for debate. But there are some, and there's also a lot of research going on right now about how long do antibodies last and whether or not they're protective. And that may vary depending on what kind of disease you may have experienced. And if you're asymptomatic, that also affects whether or not you produce any immunity or enough immunity to prevent you from getting another infection later on.
And what are the benefits of taking the antibody test for people who believe that they have had the coronavirus or have been diagnosed with it? What are the benefits of taking the antibody test after the fact?
Well, one thing, if you took an antibody test to find out whether or not you have produced enough antibodies or immunity, it might be protective. So you'd probably need further studies to find out whether or not these antibodies are at a protective level. So I wouldn't necessarily rely on that if you get a re-exposure. But another great thing is if you get a positive antibody test, you could consider donating plasma. And those antibodies that you have produced, if you have a positive antibody test after coronavirus infection, could potentially help another person who is currently infected or very ill with coronavirus, COVID-19, help them recover.
And I want to go back to one thing that we spoke about, but I want you to just reinforce, Alvina, the Labor Day weekend is coming up. People are starting to have their guard down, having a little bit of coronavirus fatigue. What should we be doing over this weekend to make sure that we and our loved ones make it through this safely?
Right. So through this pandemic, we've seen after there have been major holidays or major occasions for people to have large gatherings or celebrations, an increase in cases. And a lot of that has to do with gathering in large groups and mingling perhaps with people that you haven't been cohorted with before, or unknown persons who may have had exposures in lots of other places. We do know that there are asymptomatic infections, so if you are in a large group, potentially close together, you could be exposed, not even know it. So we really would recommend that people refrain from gathering in large groups, especially outside of their social network or social bubble, maintaining good social distancing, so physical distancing greater than 6 feet, everyone wearing a face covering, so the face covering protects the other person, so everyone around you. So really, it helps break the transmission from person to person to contain droplets. And so everyone should be wearing a face covering regardless of where you are. And good hand hygiene and good, maintaining a good, clean environment.
Excellent advice, Alvina. Thank you so much for keeping us informed, as you always do, from the front lines of this pandemic. We appreciate you being with us today.
Thank you so much. Have a great holiday.
You too. Thank you. And we'll be right back with more. Stay with us. The coronavirus has affected everybody in one way or another. One group has been especially impacted, and that is those who are already in need of some sort of aid before the pandemic began. And joining me is Lisa Blackwelder, Director of Development for United Against Poverty, to tell us more. Lisa, thanks for being with us. Tell us a little bit about United Against Poverty and what its mission is.
Yeah, thank you. Thank you so much for having me on today. United Against Poverty exists to inspire and empower people living in poverty to lift themselves and their families to economic self-sufficiency. And we do that in a few different ways. We help with workforce development. We have a workforce development program here on property. We also have a crisis stabilization program, which we help those that are trying to apply for SNAP benefits or for unemployment. We have counselors right here on property that can help with those in those situations. We just have, in our crisis stabilization program, anyone can come in with any type of problem and meet with our folks. And the great news is they leave with something in their hand or an appointment made somewhere to go. It's not empty-handed. And we also have our member share grocery program, which is the program that we're most known for, which we serve the community with, and mostly in Orange County. And we have about 30,000 members. Not all of them are active, but they are able to come to our grocery program, come through our grocery program and shop for groceries. They select what groceries they want, what they want to make for dinner. And the cost is up to 70% off your traditional grocery store. So we're helping them save their money in order to make those hard decisions, whether to eat, pay rent, as we've all heard. So.
It's a very comprehensive. So many people here in Central Florida have lost their livelihoods recently. Have you seen the number of people who have been coming to seek aid increase since the pandemic began?
So we have. In the beginning, it was a huge burst of people and tapered off a little. And then now we're seeing more people come in, grocery shopping, more people needing our services in our crisis stabilization program, our workforce development program, for the most part, has gone virtual, which was something we had to pivot to immediately. And it was in the works, but it wasn't something that we were planning on, so quickly in the year. But it's worked great. We actually had a graduation today, and we graduated 9 of our adult learners from that program, which is fantastic. But yes, we have seen an increase in the need for our service, mainly in our grocery program. It was filing for unemployment and food stamps in the beginning, but grocery is constantly busy. But the one thing that we're seeing is that they're not, folks aren't spending as much money. They're, I don't want to say the word hoarding, but you never know what's going to happen. So they're not spending as much money as they did in the beginning.
And how have you changed your delivery of services since the coronavirus pandemic started?
Yeah, so like I mentioned with our workforce development program, we have changed and we've taken that online. We've also developed a partnership with Valencia College where we have smaller classes for folks that are looking to get certification programs right here on site. And we're partnering with CareerSource for those folks who go through this Valencia program right here on United Against Poverty, our site, to have internships immediately that follow. So hopefully they can get right into the workforce. So that's one of the ways, and a couple other ways that we've done made some changes is, of course, following the CDC guidelines, social distancing, masking all the time, and limiting the number of folks in our store or in the Crisis Stabilization Center at one time, as well as sanitizing, constantly sanitizing.
And have you seen the profile of the people who are seeking services change? Is it more families, more individuals, or is it about the same as it always has been demographically?
Yeah, so I want to say it changes week to week, but I would say it's really the same demographically. Well, Now, in the very beginning, it was people that we had never seen. We had a huge increase in our membership for the grocery program, which is a free membership. But we had a huge increase in membership at that time in the very beginning, for those who just found themselves in a situation that they never thought they would find themselves in.
So how would people get information about the programs there at United Against Poverty?
Well, our website is uporlando.org, uporlando.org. And all of our information, including our membership share grocery program, membership information application, is all on the website. Before you were asking me how we've done some things differently, one of the main things I left out is that we do now have a mobile market, which essentially is one of our trucks that goes out to different communities of high need, and we sell fruits, vegetables, eggs, cheese, milk right off this refrigerated truck. And those dates would be on our websites. Those locations will be on our website as well. So, and that's a great opportunity to say thank you to Orange County government for helping us afford that program, and they've given us some really generous financial gifts to be able to take the food mobile and take the need out there. Now, of course, we're also promoting our programs while we're out on the road. And so we're able to connect those in need with where the actual physical location is. And so we're able to talk to folks all over.
That's excellent. Yeah, bringing the help to the people who need it. Thank you so much, Lisa, for being with us today.
Well, thank you so much for having me. I really appreciate it.
Have a good day. We'll be right back. We've heard from a variety of leaders today working to keep you informed about the coronavirus, from the medical community who's on the front lines dealing with this pandemic and organizations who continue to serve our community. And we are also here to help you keep making those healthy connections. Stay safe.